and virtual ability since 2009, and also helped realizing a project regarding accessibility of open textbooks for universities and such. I'm an assistant at the university in Belgium, where I also live. I had the true honor of introducing Dr. Fred Berlin, Ph.D., currently Associated Professor in the Department of Psychiatry and Behavioral Science at the Johns Hopkins University School of Medicine, and attending physician at Johns Hopkins Hospital. Sorry for this text. He is the director of the National Institute for the Study, Prevention and Treatment of Sexual Trauma, and was even invited in the White House and the US Senate to discuss childhood abuse. He's also the director of the Johns Hopkins Sex and Gender Clinic, and that's what the topic's about today. The list of publications, peer reviews, and involvements is just simply too long. The topic touches me personally very much, as he will describe, the nature of gender dysphoria, the feeling of not belonging, or not entirely, to the bird sex. Unlike my genetically XY chromosomes, I identify as a woman since I remember, regardless of my own birth sex, and I wished there were never this discrepancy. It can be a burden in many ways, but it's also a very unique situation with insight about an experience of all gender sides. Therefore, I would love very much to give you the words to Dr. Fred Berlin.
Hi, everybody. My name is Fred Berlin, and it's a pleasure to be here. As you can see on the first slide that I've got up there in front of you now, I'm the director of the Sex and Gender Clinic at the Johns Hopkins Hospital in Baltimore, Maryland. That clinic tries to assist patients that fall into three categories. I'm only going to be talking about one of those today. One of the categories we try to help folks with is people who have sexual dysfunctions. Women, for example, who may be having a pelvic pain during sex. Sometimes there's individuals, because they've had spinal injuries, have a difficult time performing sexually. That's one category we work with. A second, and again, which I won't be talking about today, but just to give you a little background, has to do with people who experience atypical kinds of sexual attractions. And because of that, for example, people who experience attractions to children, they may need some help to make sure they don't act on those attractions. Now, neither of those two categories will be discussed today. The category I am talking about doesn't have anything to do with sex, in terms of sex meaning erotic arousal. This has to do with gender. I'm going to be talking about gender dysphoria. And in simple terms, do I feel myself to be male? Do I feel myself to be female? I said I'm keeping it in simple terms because it can actually be a continuum, and some people may feel themselves to be somewhere along that continuum. But just for the ease of teaching today, I'll talk about it a little bit as though it was more of a dichotomy than it actually is. I also have on that first slide for you that there's no conflicts of interest. Those of us in academics always want to make that clear in case we talk about medicines or something of that sort, that we're not receiving any money, for example, as a result of that. Next slide, please. Now, this is just an overview of what I'm going to try to cover today. I'll go into more detail on some of it than on other parts of it. I want to, first of all, make clear what gender dysphoria is. And I like to stay away from jargon, but we'll have to define what that particular term means. Secondly, I want to talk about what we do and don't know about the etiology of gender identity. What factors do we know may or may not contribute to a person feeling that they are a member of a particular gender. Secondly, I want to talk about the historical nature of this of gender dysphoria. There's been a lot of attention paid to this recently in our culture. Some people seem to think that maybe this is a new phenomenon. That's absolutely not true, and I want to just give a little overview about that. And then I also want to make it clear that it's not unique to North American culture, that what we're talking about here has been around for a long time and in all parts of the world. Finally, I'll touch briefly on a little bit about gender dysphoria in our modern era, some of the treatment options. I'm not going to go a lot into treatment, but just to touch on it. And again, because of time, I won't have a lot of time to discuss children and adolescents, but I want to at least touch on it. And if people have questions subsequently, try to answer those. Next slide, please. Now, what is gender dysphoria? And again, I like to talk about this in as common sense a way as possible. And so I'm going to discuss it here on this slide and then expand slightly on the next one. Gender dysphoria is simply a distressing feeling, a distressing discrepancy between the image that someone sees in the mirror. I'm looking in the mirror and I see what looks to be a male, but internally I feel myself to be female. And that's what we mean by gender dysphoria. There's this dysphoric or distressing feeling because of the disparity between the image I see of myself in the mirror and the person I know myself to be internally. Next slide, please. Now, I often find it helpful, I'm a physician, to try to imagine what it must be like when I'm working with folks and trying to assist them. And I think the easiest way I've found to be able to understand that is to imagine what it would be like to wake up one day with the external anatomy of the opposite sex. In other words, I'm a male myself, and so suppose one day I woke up and I didn't have a scrotum, I didn't have a penis. Instead, I had breasts on my chest and I had a vagina in my groin area. And again, any of you can imagine that, what it would feel like to wake up one day having the external anatomy of the opposite gender. I think you would all agree with me that would be an extremely distressing feeling. It wouldn't be just cosmetic. It would go right to the core of seeing a body that was in no way in keeping with the person you know yourself to be. Next slide, please. Now, I just wanted to make the point that for whatever reason, there's tremendous emotion attached to this situation where someone is dressing in a way that's not in keeping with what society is ordinarily expecting. And we still see today this tremendous emotion. There are states now trying to legislate in ways that I think are very not thought through very well at all because they don't have an understanding of these issues. And so I simply put up here a picture depicting Joan of Arc, who was executed back in 1431. And there were several reasons that were given for her execution, none of which really made any sense. She had been cross-dressing to camouflage herself because she was in a war and fighting as a soldier. And one of the reasons that they felt justified in executing Joan of Arc was because she was a woman who had been dressing in male clothing. And again, that's back in the 1400s. We still see such strong emotions today when it comes to these issues. And sometimes those emotions make it difficult for us to have a thoughtful and rational discussion about these matters, at least in my opinion. Next slide, please. Now, the other thing that often comes up, because I'm distinguishing talking about gender, do I feel myself to be male or do I feel myself to be female or someone somewhere along that continuum? That's separate from sexual orientation and sexual arousal. Who am I attracted to sexually? And some of the terms we ordinarily use, like homosexual or heterosexual, would just be confusing when we talk about people with gender dysphoria, because are we using as a frame of reference the anatomy that they might be seen as having at the time that before they've undergone any changes as part of treatment, or are we talking about how they perceive themselves to be internally? So the point I want to make is when we're talking about a person who is on the transgender spectrum, rather than using terms like heterosexual or homosexual and talking about sexual orientation, we should just say this isn't a person who's attracted to men, this is a person attracted to women, this is a person attracted to men and women. It'll be much less confusing, and I think it's important that we be clear and how we talk about these matters and understand them. Next slide, please. Now, there are a number of terms that are used because we sometimes think of sex as just male or female or some simple dichotomy, but sex can be looked at in a variety of ways. We can look at sex of assignment. When the doctors first see the child, do they think they're seeing a male or a female? Is the child assigned the gender of boy or girl at birth? There's the phenotype, the external anatomy. That's another thing we can look at when we're talking about sex. We can look at the genotype. What about the chromosomes? All of us, most of us, I should say, have 23 pairs of chromosomes for a total of 46. So it's 23 pairs for a total of 46. You can actually take a white blood cell from a person and prepare the nucleus of that cell in a certain way, and under a high-powered microscope, look and actually see those chromosomes. And if the 23rd pair looks like an X next to a Y, that's usually what we find in a male. So that's said to be a 46XY male chromosome pattern. If the 23rd pair looks like a X next to an X, that's said to be a 46XX female chromosome pattern. So we can look at that. And then the final things, I don't want to get too much into a rabbit hole here, that I do want to talk about are in the bottom of this slide, and that is that people should not confuse gender identity with gender role. Gender role has to do with the expectations that society places on an individual at any given point in time. In our society now, it's more common for men to wear a tie and women not to, though I think thankfully actually some of those things are changing. At one time in our society, it was expected that men would be doctors and women would be nurses. Again, I'm glad that's changing, but that has to do with gender role. That has nothing to do with gender identity. Gender identity, which is what we're talking about today, has to do, again, with do I feel myself to be male? Do I feel myself to be female? Or am I somewhere along that continuum? So again, let's please not confuse gender identity with gender role. Next slide, please. Now, what about the etiology of gender identity? Whenever scientists are talking about etiology, as you all know, we often say, what's the role of nature? Biology, what's the role of nurture, life experiences? And the first point to make is we shouldn't see that as an either or. It's often a question of to what extent do each of these play a role in the determination of gender identity in a given individual. But before I get a little bit more into that, I want to make the point that we sometimes don't talk about, and that is what gender identity is not due to, and that is that it's not due to choice. You know, we talk about choice quite a bit in our society, and people making bad choices, bad decisions, and that sometimes happens, but not everything is about choice. And neither are our sexual attractions nor our experience of gender identity are about choice. Let me expand for a moment. I'll start with the issue of sexual orientation and then get to the issue of gender identity. When I was a little boy, I didn't weigh my options and say, look, you've got some decisions to make. Do you want to grow up to be heterosexual? Do you want to grow up to be homosexual? Do you want to grow up to be attracted to little children? None of us as little children reflect upon our options and decide what the nature of our sexual orientation is going to be. In growing up, I discovered that I'm attracted to females. And so it wasn't a choice I made, it's a discovery about myself that I made. Similarly, if I were gay, it wouldn't have been because I had decided to be attracted sexually to members of the same sex. It would be because I discovered in growing up that that's the nature of my attractions. To come over to gender, again, I didn't, as a little boy, sit down and ask myself, do I want to grow up to feel like I'm a male? Do I want to grow up to feel like I'm a female? In growing up, I discovered the nature of my own gender identity. I did not decide it, and I think it's very important that we all have an understanding of that. Now, having said what gender identity is not due to, do we know anything about factors either from nature or nurture, from biology or life experience that might be contributory? And I might add that most of us just assume, before I move on, that gender identity is really developed because of what our parents and society has told us, that from the time we're born, our parents, others say you're a boy, you're a girl. But I want to look at that empirically. And so let's move on to the next slide, please. This is going to look at the question of whether gender identity, which we think of as a societal construct, whether it's more complicated than that, and whether it can actually be influenced by biology in some way. And so I'm going to talk to you in a moment about a study that addressed that issue. And let's move on to the next slide for me to be able to do that. This was a study published in a well-respected medical journal, the New England Journal of Medicine, back in 2004. One of the co-authors of the study was actually a man named Bill Reiner, who was a resident here with us at Johns Hopkins many years ago. And the name of the study, I'll read it out, is Discordant Sexual Identity in Some Genetic Males with Cloacoestrophy Assigned to Female Sex at Birth. Now, those are a lot of words that we could stumble over. So rather than doing that, let's move on to the next slide. Now, again, I'll get even beyond this by showing you a picture, but a definition of cloacoestrophy. It's a rare embryonic deficit of the pelvis and its contents associated with severe phallic inadequacy or phallic absence in genetic males. So the point I want to talk about here in the study that we're going to be discussing is that all of the children, the babies that were born here, are XY males. Genetically, they are males, but because they have this abnormality, when we look at them, we're not going to know whether they're male or female. Next slide, please. Now, this is a picture. It's actually a male, but this is what this child would look like if they're born with cloacoestrophy. And I might take a moment to pause, because imagine how difficult this is for the parents, for the doctor. You know, the first question often that a parent is going to ask if they haven't done testing ahead of time to know is my child a boy or is my child a girl? And yet when the child is born with this type of genetic abnormality, in looking at the child, one is not going to be able to tell. Now, this example we're giving here would be an XY baby, so genetically it is a male, but I think you can see here that we're not going to be able to tell by looking. Now, back when this study was done, that I'm in the midst of discussing, some 20 years ago, we didn't have surgical techniques that would allow us to anatomically be able to have this young infant raised as a male. We weren't going to be able to create a penis. We just weren't going to be able to do anything where this child, if we raise the child as a male, even though he has XY chromosomes, we're going to be able to do that in terms of having the anatomy of a male. And at that time it was felt, well, because we do have the surgical techniques, maybe we can just raise these children as female. We'll tell them they're female, their parents will raise them as females. And if it's really environment and what our parents and society is telling us, hopefully having the female anatomy will be fine and they'll be content as females. Next slide, please. This is just a little bit of a summary. There were actually 16 of these infants that were born this way, all of them with the XY male chromosome makeup. They were assessed between the ages of 5 and 10. 14 of them, the parents agreed in terms of what I just told you, that because they couldn't do surgery to make them look in any way like a boy, that they would agree to have the surgery that would have them look like a female. 2 parents, as of course their right to do, just did not want to do that and refused the surgery. And even though they were going to be boys without a penis and testes and so on, they were going to still raise them as boys. And there was a follow-up that went on for a period between about 3 to 8 years approximately. Next slide, please. Now I'll get into even more detail on this in the following one, when I change to the next one. But right here, to give you some of the results, 2 of those raised as a male were still living as a male. Now that's not very surprising, but again, remember, they're males who do not have the normal male anatomy, but they still feel themselves to be males, and they're doing the best in spite of having that kind of a challenge. However, by the time of follow-up, even though the 6 that are in the second line had been raised as females, by the time of follow-up, they, no matter, in spite of the fact their parents told them they were females, they didn't know otherwise and so on, 6 of them were living as males, and 2 others, although they weren't yet living fully as males, had declared themselves to be males. One raised as a female was unclear at that point about gender identity, and 5 raised as females were still living as females. Now, I'm going to summarize a bit more in a few moments, but I also wanted to make an interesting point at the bottom of this slide, because again, we all assume that the way in which the toys that the children are interested in playing with have very much to do with what we present to them. In other words, that if I have a young female daughter, I encourage her to play with dolls. If I have a young female son, a young male son, I encourage him to play with trucks. Well, what was interesting in this study, even though a number of these XY males were raised as females, they were encouraged to play with dolls. They were told they were females. Every one of these youngsters, when they got older, engaged in play that was typical of males. In other words, even though their parents wanted to give them dolls and other items more typically played with by girls, all of them wanted to play with trucks and things that were more typically boy kinds of toys, suggesting, perhaps surprisingly, that it may be biology that plays a significant role in this, and not just the environment in which children are raised. Next slide, please. Now, again, at the bottom of this, just to kind of come to the conclusions of what is important here, biology had a tremendous effect here, that 57% of the time, that 8 of these 14 XY males raised as females, told they were females, didn't know they had the XY chromosome pattern, ended up living or self-declaring themselves to be males. And so it's very clear that what was responsible for the feelings of gender identity in these individuals had to do with factors related to their biology. Now, again, things are never either or. 43% of them, 6 of the 14 raised as males, were still living as females by age 16. Now, I might add, we don't know because the study didn't go on what happened with them later on in life, but it does appear that in some cases that perhaps nature can have more of an effect than biology. That life experiences perhaps can have more of an effect than biology in determining gender identity. But the points I want to make are to remind us of the first one, that gender identity is not determined by a choice of a particular individual. It's discovered. I'm showing you some evidence that in many instances, it may be that the person feels they belong to a particular gender because of something about their biology, but I'm also making the case that sometimes they may feel that way because of factors related to how they were raised and early life experiences. Next slide, please. Now, I want to follow up a little bit more because I think this is the part that people haven't really paid as much attention to. There's still too many people that think that the children choose what gender they're going to experience themselves to be rather than discover it. And many people, because the studies are often not done, just don't even think that maybe I'm feeling myself to be male or I'm feeling myself to be female because of something about my genetics, about my biology. So I wanted to tell you about this one case that I had seen myself a number of years ago at Johns Hopkins. It was a 9-year-old boy, looked like an ordinary 9-year-old boy from a very good family. The parents got along well. There was another sibling in the family who had no doubts with respect to gender identity. But this 9-year-old boy was just insisting that he was a girl, insisting that for even before 9. And when we saw him at 9, was still insisting that. He insisted in dressing as a girl. There didn't seem to be anything about his life experiences that we could understand that might explain this. And so one of the things I decided to do with this youngster was a chromosome analysis, to look at his chromosomes. Now, if you recall, I said earlier, all of us have 23 pairs of chromosomes for a total of 46. And ordinarily in a male, the last of that chromosome pair looks like a 46. That 46 pair looks like an X next to a Y. And if it's the chromosomes that are being taken from a female, that last 23rd pair, 46 chromosomes, the 23rd pair looks like an X next to an X. And as I mentioned earlier, we're able to actually look at these chromosomes by taking blood cells, white blood cells from an individual preparing the nucleus of the cell, the center of the cell in a certain way, and under a high power microscope looking. And ordinarily, all of the white cells and the nuclei that we take from a given individual will look the same in terms of the chromosomes. That final pair will actually look like a 46XY or a 46XX. Now, in this young boy, we had taken several white cells to look at the nucleus. A number of the white cells, the nucleus was XY, which would have suggested this, if we're just looking at chromosomes, as a boy. But it turns out that when we looked at some of the other nuclei, some of the other cells, it looked like, and it was the case, that the chromosomes, the 23rd pair, looked like an X next to an X. And so this is a rare condition called a chimera, where some of the cells in the person's body are 46XY and some are 46XX. Now, I would suggest that it seems far more than just a coincidence that this young, appearing to be a boy, kept insisting that he was a girl. Now, again, we can't do a brain biopsy. We can't go look at whether there's certain areas of the brain that have the 46XX rather than 46XY chromosome pattern. But I don't think there's any doubt that the reason that this young 9-year-old felt that he, I should say maybe now she, is a girl, is because there are numbers of cells in her body, presumably critical ones in certain areas of the brain, that are 46XX rather than 46XY. So it's a little complicated, but I hope that everyone understands that. And I'll talk a little bit more about children later on. How should this child be raised? Should this child be allowed to play on girls' teams rather than boys' teams, and so on? I won't answer that now. I can answer later if people want, but these are the kinds of issues. And again, we understand there's a pretty strong biological reason now why this young boy, this person who looks like a boy, would be feeling internally to be a girl. Next slide, please. Okay, now again, I mentioned the issue of sports. So I want to get briefly into this because this seems to be a hot topic. And so let me just start here by talking about the bottom of the slide, adults. I'm going to skip over children for the moment. None of us want our children, even our grown children, to be any kind of a disadvantage when competing in sports. We all understand that. We want games to be fair and so on. But I want to make the point that for persons that think that a trans female competing in female sports has an advantage, they often don't understand why, in fact, that may not be so. In other words, the reason that a natal male, a man that's born, a person born with the XY chromosome pattern, might have an advantage over a female born with the XX chromosome pattern is that the Y chromosome causes that when the fetus is developing it to develop testes, which in turn produces testosterone. And testosterone is what causes an increase in muscle bulk, an increase in stamina, and so on. It's why in many instances, an adult XY male will have an advantage over an adult XX female. It's that presence of testosterone and what it's done. But keep in mind that most trans females have had their testosterone lowered. They've either undergone surgical castration or they're taking medications that lower testosterone. And that means that the muscle bulk that might otherwise have been present gets diminished. Some of the advantages in terms of stamina get diminished. That if we really understand the biology of this, the trans woman does not necessarily have an advantage over the XX female when competing in female sports. Next slide, please. I also want to make the point that there are often advantages, biological and otherwise, in many instances, and in my judgments, that's not what should determine who is a winner and who is successful, and I don't think it is what does. There are clearly many people, because of their genetics, who are taller than others, who have a different genetics, and so they're going to have a big advantage in basketball, but we don't screen for the genetics of basketball players and decide if you have a genetic advantage because genetically you're going to be taller, that somehow that you're competing unfairly. I might mention at the top of the slide, Michael Phelps. I want to make it clear I'm very supportive here of Michael Phelps. But what some people may not have known, and again, to remind everyone, I've forgotten just how many gold medals he won as an Olympic swimmer. It turns out that Michael Phelps, and this is publicly known, I'm not saying anything that isn't already known, had a mutation on one of his genes, which caused his arms to be a bit longer than they might otherwise have been, which gives him a much better swimming stroke. There was more flexibility of his joints. Again, because of this genetic factor, he produced less lactic acid, which means that his muscles tire less easily and can go longer before tiring. And so Michael Phelps clearly had a genetic advantage in competing in swimming. Now, I do not believe that we should have been doing genetic testing and that Michael Phelps should have been excluded because he had genetics that were different from many others. And that's not what won for Michael Phelps. Michael Phelps won because why most athletes win who are competitive. It was by working hard, it was by perseverance, it was by dedication to the sport, not because of biology. And so the point I'm making here, and I know it can be controversial, but I do not believe that if I am a trans woman, that I should not be allowed to compete in female athletic events. I may not have any advantage at all. And even if I did have a slight advantage, I would argue based on the points that I've been making here, that that would be no reason to exclude me from participation. Next slide, please. Now, I'm going to go through some of this quickly, but it seems that some people are thinking that this issue of gender dysphoria is some sort of a new phenomenon, and we've got all this backlash amongst legislators who are talking about these are new woke ideas and all of that stuff that to me makes very little sense. So I just want to talk a little bit about the history of this. Next slide, please. There are many, many examples. Because of the length of this talk, it's usually a longer one I skip, but I could have gone through many, many examples from many cultures around the world, and I'll talk a little bit more about that subsequently. But just to pick one, and this is not by any means unusual. I think it's a picture sometimes is worth 1,000 words. This is a person, Elagabalus. He was also known as Marcus Aurelius Antonius. He was an emperor of Rome back in the early 2nd century AD. And again, sadly, they didn't live very long back then. But I want to talk a little bit about him in the next slide. It's fascinating how archaeologists and historians and others can gather this information, but people studying him actually were able to find documentation that Elagabalus wanted to have his body hair plucked. He didn't want to have chest hair and hair on his legs and so on. Elagabalus, and he was the Roman emperor, so he could do what he wanted to do, was known to wear female makeup. He also wore female attire in public. And there's documentation that he offered physicians money if they could change his body. So here back around 200 AD is what would be the first recorded interest in what we now refer to as gender-affirming surgery. This is not some new woke idea. This is something that has been around historically for quite some time, and I could go back even further in time as well. Next slide, please. So that's talking about going back in time. What about cross cultures? Let me go through this fairly quickly. Next slide, please. In Thailand, I'm just going to give a couple of examples. I could give even more. In Thailand, there's a group that are known as the Katoi. These are XY males in terms of their chromosomal pattern who live openly as females. Many, thankfully, are well accepted. They tend to work in areas that, in terms of the way things have been looked at more traditionally, were traditionally in Thailand work done by females in shops and beauty salons and certain forms of entertainment. Next slide, please. This is a picture of a group of Katoi. I think you'll agree with me if I wasn't telling you these aren't women. They all are women. They happen to have an XY chromosome pattern, but these are all women. They live their lives as women, and they're accepted as such, and an example in a culture somewhat different than our own. Next slide, please. Now, in India, there's a group called the Hijra. Again, this dates back all the way to the 2nd century of the Common Era. Many of them would live in organized communities led by a guru. Now, India, as many of you know, had for many years been a country that had a caste system. They had a group there called the Untouchables, which it's just so sad to think about. And even as recently as 2014, India's Supreme Court decided that persons who were transgender, in this case referring to the Hijra, were entitled only to diminished rights as human beings. I worry that we're seeing some cases in this country now where legislators and others seem to be wanting to move in that direction. I might point out that there was a minority report by the Supreme Court in India that deplored that majority decision. Next slide, please. This again is a picture of a group of Hijra. They live their lives as females. I think we would all agree that these are females, even though if we were to test them genetically, they would all have an XY chromosome pattern. Next slide, please. I'm just going to give one more example. This is an interesting group called the Warriors that reside in Indonesia. They are, again, all XY genetically, but in terms of gender identity, feel themselves to be female. They believe they have the souls of a female, but because of their religious convictions, they don't believe it would be right to change their body in this life. They feel they were born as men and that they're meant to return to God as men, and then their souls after that would exist as women. And so these are, even though they are XY chromosomally, and although they, in terms of gender identity, believe themselves and know themselves to be female, would not be interested in gender-affirming surgery. Now, the next slide, please. This is a picture of Avi, who is a warrior. She, at the time, was in the past, in Jakarta, a childhood nanny for Barack Obama. And nobody back then, including, I think, Barack Obama's mom, knew that she would have had an XY chromosome pattern. Judging from the success of Mr. Obama, I think she must have done a wonderful job in assisting and raising him. It was only after he had become president, and a story about this was written by the Associated Press that she was outed, and I understand began to have some difficulties from some other folks once that had happened. The next slide, please. Now, again, I'm getting into the modern era, and I said before, I think a picture is worth 1,000 words. And the only reason I'm putting this up is that it troubles me that sometimes when people are talking about persons, human beings who are transgender, they'll put up pictures, and this is usually by people who have little understanding about these matters, where they'll put up a picture that purposely looks like, for example, somebody that appears to be a man trying to look like a woman. And that stigmatizes and so on. And again, I'm not criticizing if someone doesn't pass well. We should still be very accepting. But I wanted to make the point that that's not necessarily the universal situation when we're talking about transgender human beings. So I just put up this picture of Joy Layden. She's a little older now than what this slide would show, because I prepared this a while back. But she was actually the first openly transgender professor in an Orthodox Jewish institution. Very, very accomplished woman, and just clearly an example of someone who should be accepted as a woman, is a woman, and is living her life in such a manner. The next slide, please. Now, again, I'm not going to go into detail with treatment. Theoretically, one could argue that perhaps people could learn to change their mindset to be comfortable in their body. I think most people who are transgender will make it clear that they can no more do that than I could learn to, if I woke up, as I said, one day with a different anatomy, learn to be comfortable in that body. Maybe if I had no choice, I'd go on with life. What else can I do? But in terms of having an optimal, enhanced sense of mental well-being, people are not able to change their mindset to accomplish that. They really can often have this enhanced sense of mental well-being by changing their body to conform to the way they know themselves to be mentally. I'm not going to go into all the talk about hormones and surgery here, so let's just move on to the next slide. There's just not enough time to go into all of that. This was just a study. I've tried to talk about concepts here, but it was done in a Swedish study. It was a study of fairly large, of 324 individuals who were sex reassigned, 121 born with XY genetics who had surgery to affirm them as females, and 133 in the other direction. Next slide, please. And again, the overwhelming majority had what I was just talking about. They had an enhanced sense of mental well-being. In other words, the surgery, and again, this is very serious surgery. We're removing anatomy that has no pathology in it. We're removing breasts that have no pathology. We're removing penis and testes that have no pathology. So are we doing this for good reason? And the answer was, in that large study, that the overwhelming majority of these individuals did indeed have an enhanced sense of mental well-being. That's the procedure is surgical, but the intended outcome is in terms of the mental well-being, the mental experiences and health of the given individual. Now, I don't want to, just candy coat. I'm trying to be objective as a scientist and physician. There were some people that actually still, in spite of that, committed suicide. It wasn't a panacea. People still, in some cases, had other mental health issues. Again, I'm not going to spend a lot of time on that. I'll just do a couple more slides just to highlight it. But what I don't want us to lose track of is that the overwhelming majority of people who had what we now call gender-affirming surgery had this enhanced sense of mental well-being, who they knew themselves to be mentally now was conforming with who they saw in the mirror, who others saw, and that was something they described as a very welcome thing. Next slide, please. Now, people do, and again, we talk about what we call this top surgery, bottom surgery, and so on. But, people do want to be able to be seen by the world as the person they know themselves to be. And the world doesn't necessarily see our genitals or what's on underneath our clothing. What the world does often see is our face. And so there's an increasing recognition that perhaps another part of what should be referred to as as affirming surgery should include facial surgery. And again, if we're talking about a woman, it will be facial feminization. I might mention it's often much less necessary in a trans man, because when a trans man receives testosterone as part of transition, the changes are extremely profound. That individual will grow a beard, their voice will deepen. The trans man often does not need anything to help him pass. He very often will pass quite easily, but trans women are often in a different boat. Next slide, please. And so this is a picture of an individual. This is the same person, by the way, who has had facial surgery. And I could just get you to guess who it is, but I won't do that for you. The picture on the left is the way this person looked initially. This individual has an XY chromosome pattern. The picture on the right is how this person looked after gender-affirming surgery to the facial area. And I think you'll agree that anyone looking at the picture on the right is going to rightfully conclude that they're looking at a female. Next slide, please. Now, again, as a physician, I have an obligation, and particularly with my patients, to make sure I'm being objective. And although I absolutely support gender-affirming surgery, and I think it helps many people, I don't want to hide the fact that there have been a few people, and we're trying to get better data on what the percentage is, because people who are sorry don't later always report it, or sometimes tragically there's suicides and so on. So I don't want to put this out of proportion, but sometimes there are advocacy groups and others that don't even want to talk about this, and we want to have an honest discussion that covers all aspects of this. So there are some people who do have some post-surgical regrets. Next slide, please. This is a gentleman shown when he's rather young named Walt Payer, and a nice-looking gentleman. He began to have feelings of gender dysphoria, went to see a psychiatrist. Next slide, please. And subsequently, he had gender-affirming surgery. This is exactly the same person. You can see that she now clearly would look to the world like a very attractive woman. Next slide, please. But this is that same person later on in life, and I'll call him he now because he is he, regrets the fact that his psychiatrist didn't encourage him to spend a little bit more time thinking it through, making sure he understood all of the implications, that indeed he wasn't going to have any regrets. and was distressed that the things were that he felt his mental health provider should have just slowed him down a little bit and helped him make absolutely sure that this was going to be the right decision for him. Now, again, I think this is really more the exception than the rule. I want to underline that, but it's still very serious circumstance when we've got someone that later regrets that they've gone through all of that. And so I felt my obligation to let you know about that, and we feel obligated to tell our patients. Well, all of our patients who are going to undergo surgery deserve to have full informed consent, and they need to know all about the pluses, the minuses, the alternatives, risks, benefits, and so on. And so I want to present you with a complete picture. I'm a full advocate, and no one should discriminate and so on, but as a physician, I also have to be objective, and there are a number of medical issues that still need to be, and mental health issues even, that need further exploration. Next slide, please. Now, I don't have much time to get into children and adolescents. This is a whole area of its own. But what I want to at least make people aware of is that when an individual, a young person, has felt themselves to be of the gender that they don't see in the mirror, and they've been feeling that way throughout their pre-adolescence and in adolescence, that person is likely going to continue to have these feelings of gender dysphoria into adulthood. But a complicating factor that has been shown by research is that when we talk about prepubescent children, who a prepubescent child who feels that I look like a boy, but I think I'm a girl, or vice versa, and so on. In spite of the slide that I showed you earlier, where there was probably a biological factor that was causing what looked like a boy to feel like a girl, significant numbers of prepubescent youngsters who feel themselves, who have what I'll just refer to as gender dysphoria, who want to cross-dress and so on, do not continue to maintain those feelings by the time they reach adolescence. And so I think I have a next slide on this, and we can move on to this. Next slide. Yeah, this is a real dilemma. What should parents do? What should society do? Presumably none of us want to change the trajectory, that if the child, when is kind of left to mature on his or her own, was going to end up experiencing on into adulthood gender dysphoria, we would want to support that. But if this turns out to have been a child where those feelings weren't going to be sustained, did we want to prematurely start to support something that indeed wasn't necessarily going to go on in that direction? I know this is controversial. It's tough. Some people are saying, should we suppress puberty by giving hormones and so that we can then decide later on? But that's not without its side effects. It can stunt growth and so on. So again, this is a whole other area that needs much more discussion than we have time to get in here to today. But I at least wanted to present you with a little bit of factual information and help us understand why this is such a challenging area. Next slide, please. All right, so there's a lot more I could say, but I really did want to leave about 10 minutes or so for questions. So let me talk about the what I would see as the conclusions here. The first one, and maybe that's the most important one of all, is that we should treat all of our patients with dignity and respect. We should oppose any kind of discrimination that is based upon gender, whether it's cisgender, transgender, anything along the spectrum. These are not some new woke ideas. The people with gender dysphoria or gender incongruence, I don't care what terms we use, have existed for as long back as we can know. They've existed across all cultures. And so that perhaps is the most important takeoff, that we want to respect and treat all human beings, including folks who are transgender, with dignity and respect. As far as myself as a physician, I need to present accurate information. I want anyone who ultimately is going to have surgery or hormones to be fully informed, have informed consent. What are the risks, benefits, options, alternatives, and so on. And to continue to do research, to advance our knowledge, have better information to present to, as a physician, to our patients. A principle I always follow in terms of some of what we heard here today. Again, I very much want to support whatever is going to be helpful to those who come to me as patients in terms of enhanced sense of mental well-being and so on. But some of our patients are ambivalent, some aren't sure. Sometimes we have people who are depressed and they're beginning to doubt their gender. The depression goes and they're not having those feelings any longer. So we want to make sure we've done a thorough assessment, that we've worked in a partnership with our patients. And I do talk with my patients about the fact that it's much more important to get it right than to get it fast. I know there's often a sense of urgency, but we want the best possible outcome for our patients. And so that's a principle that I think is useful to keep in mind. As you can see, there's a lot more I could have said. I just wanted to touch on what I think are some salient points. I thank all of you very much for your attention. And if you have some questions now, I think I've left approximately 10 minutes to try to answer your questions. And again, thank you very much for having me. I very much appreciate that.
Thank you very much, Dr. Berlin. I just want to let the audience know that there is a giver box in front of the podium for additional materials from Dr. Berlin. And now I will look for a couple of questions. So I see one coming from, speaking of Olympic swimmers, Shiloh mentions that Olympian Bruce Jenner was criticized for his change in his gender to her natural inclination. Some even said that she should return the Olympic gold. Being in the public eye must have influence and exaggerate the challenges of whatever a person undergoes a sex transition. That's just a comment from Shiloh, but she also has a question. And the question is, I saw a documentary that in ancient Sparta, women were encouraged to be athletic, to fight, to be the best athletic self they could be, even go to war if necessary. How many cultures historically were more accepting to women, at least, crossing what is today gender-specific activities?
Well, I think there are cultures, and I skipped some of it, that have been more accepting. I don't want to suggest I know an exact number, but for example, many of the North American Indian tribes, it was often thought that the transgender female was someone that should be held in high esteem, that they often were seen as persons who could be healers. Again, some of the slides that I showed indicated parts of the world where the transgender females in particular were more well accepted certainly than occurs in some parts of this country. But the sad reality is that, and I don't know if this is just not maybe more the darker side of human nature, that there's just been a tendency when we talk about things collectively where individuals as a group tend to be less accepting and sometimes to dehumanizing people who come from different groups. We see that not only in the area of gender and sex, we sometimes see that with practically every group of immigrants that's come to this country. If you look at the history, whether it was the Irish coming here, whether it was Chinese immigration here, we're seeing a lot now. So I wish I could say that we've evolved as human beings to the point where we're all trying and accepting of the fact that what matters is that we're just fellow human beings. We're all sharing this earth together. We all deserve to be treated with equality and dignity. I don't think that's ever been quite the case when it comes to transgender folks, though some societies have been better than others. I hope that our society can strive towards becoming the role model of how we should be accepting. And I see amongst our younger generation, I've been teaching, I'm older now for many years, and I think particularly amongst the younger generation in general, there's exceptions, but in general, there's much more acceptance of diversity along all lines, whether it has to do with color, with ethnicity, with sexual orientation, with gender identity. So I hope that means that in our culture, we're now moving in a more positive direction, but not naive of the fact that there are some backlashes taking place simultaneously.
Thank you. That was great. And Rhiannon mentions that you were referring to the Two-Spirit people with indigenous populations across North America. I would also have an early question here from UCAM, who asked, why does the psychological profession define it in terms of distress?
Well, that's a good question. I'd actually skipped a slide on that. It's not. It's certainly not a disorder in the same way that some conditions are disorders. I don't call it a mental disorder. In fact, the big change that took place in the DSM is that we dropped the label gender identity disorder, which we rightfully dropped, and talked about gender dysphoria. We may even change it to gender incongruence. But one of the things that mental health people do is we help people when they have some sense of distress or discomfort. Depression would be a good example. You know, we're not saying that somebody isn't thinking, isn't right in their mind when they have depression. We're just saying they're suffering. And we in the mental health community, if we have ways of alleviating their discomfort, their distress, or depression, want to do so. As I said earlier, fundamental to the term gender dysphoria, or well, I don't care what term we use, but understanding what's going on, is that people have a discomfort because of the disparity between what they're seeing, the person they're seeing in the mirror, and whom they know themselves to be mentally. And so the whole goal here, and why mental health is involved, is that we want to assist people in having that enhanced sense of mental well-being that comes out of the treatments that are available to assist individuals who are experiencing that kind of discomfort. So we can talk about the words, where it's best categorized, but it is really about mental comfort in the same way that if you're depressed or you're in pain, we see that as a mental health issue, and we want to diminish your pain, diminish your depression, diminish your discomfort. So I know this is a delicate area, and again, it probably has something to do with the stigma about mental health issues in general. If they were less stigmatizing, I think there'd be less concern about why we in the mental health profession are interested in assisting people who are feeling this discomfort about the disparity between the body they see and the person they know themselves to be.
I think that, well, we are running out of time, unfortunately, but there are some other sort of comments about, just recognizing that, changing our language and the effects that may have on suicide rates. And then someone else commented that they noticed her friend noticed her identity in her late 40s and moved to another state to because the laws are more inviting there. So, the legal aspects and the social aspect. So thank you very much for that. And please, everyone, remember to pick up the materials from the front. Just click the giver box, and let's give a big virtual ability thank you to Dr. Berlin for a most fascinating topic. Thank you very much.
Thank you all. I appreciate that.